Good evening, everyone. Thank you for coming. I'm here to speak to you today about the healthcare crisis that we have here in America. Healthcare has been debated in the United States and all over the world for years. However, the United States has implemented a healthcare insurance that is supposed to be affordable for all Americans, more so based on an individual's income. Some seem to think that this insurance is not so affordable at all, but costlier than most private insurances. Some private insurances premiums are more cost effective. Not only are Americans worried about insurance premium, but their coverage clause. Some Americans want free health care, like the Canadian health system. Canada government offers free health care to all Canadian citizens. Americans are baffled by this because America is one of the richest nations. In the United States, there are other government insurances that are afforded to Americans at no cost. Medicaid is afforded to Americans with children that are unemployed or has very low wages. I know we all want better health care and cheaper premium, but this is not possible. Premium rise when healthcare providers such as hospital, doctors' offices of all specialties raise their prices on procedures, office visits, and hospital stays. Some people's income doesn't substantiate for the higher insurance premium. Wages don't rise as fast as insurance premiums rise. Uneducated, homeless, and low-income families are more likely to be without health insurance than any other social-economic group. I am a government employee working at the VA caring for veterans daily, and I constantly hear them praise the healthcare option because if not, they would not be able to afford health insurance on their jobs. Alrighty, rise in insurance premiums. Pre-existing conditions and providers denying certain insurances has created a growing problem for years. However, as politicians work to fix these problems, our healthcare crisis is slowly being resolved. The affordable insurance, which is called Obamacare, has created an uproar among citizens. According to ObamacareFacts.com, the Affordable Care Act has set the foundation for insurers to cover people with pre-existing conditions. Meanwhile, parts of the law like the rate review provision and the creation of health insurance marketplace help to reduce premium costs. So many feels like lawmakers are one-sided and are not mindful to the premium increases nor the stagnant salary increases, which doesn't complement the rising health care costs. Many Americans dropped their insurance under the Affordable Care Act once the mandate penalty was seized. If the premium rates were specific to lower incomes, we would have more insured Americans. Because America is so generous to ensure that everyone in this United States is insured causes for higher premiums. As for other countries like Canada, who cater only to citizens, can afford all citizens free health care. Being that America is generous to all living in America brings hardship to all of us. More and more Americans are plagued with comorbidities, which causes healthcare costs to rise. Hospital visits and admissions are on the rise, with uninsured patients by a large percentage. Some that has affordable insurance can't pay the co-payments at hospital and doctor visits, so many won't seek treatment because of this situation. We all know that some urgent cares or doctor offices will not treat unless co-payments are paid at the time of visits. On the other hand, many will go to a hospital emergency room to be treated for common cold versus a doctor's office or urgent care because at a hospital, they don't require upfront payments to treat a patient. Again, unnecessary cost for a common cold that is being treated at a hospital, whereas the cost is less at an urgent care. Even though a person has the affordable insurance, they are still not able to afford co-payments. According to the Philadelphia CBS.local news, we should protect and build upon the Affordable Care Act, and our plan would give Americans the choice to buy into a public option like Medicare, which was stated by some politicians. Pre-existing illnesses. Here's a website that shows that from 2007 to 2009, 651,000 applications rejected from just 4 of many insurance companies for pre-existing illnesses. Pre-existing illnesses have been denied by many insurance companies. I personally can attest to this. I transferred from one job to another in 1998, and I was 3 months pregnant. I was denied health coverage for prenatal care because it was considered a pre-existing condition. However, I had to have a written letter from my OBGYN doctor and taken to the Medicaid office, which took 3 months to get approved. However, I was approved for prenatal Medicaid just until I gave birth to the baby. I was responsible for paying all visits until approved by Medicaid. Medicaid paid back 3 months of my care to doctors' offices once I was approved. My point is that there are so many others that may not have been able to cover the costs financially to the doctors and would have gone without prenatal care until Medicaid was approved. According to government preexistingconditions.com, under current law, health insurance companies can't refuse to cover you or charge you more just because you have a pre-existing condition. This is a health problem you had before the date that new health coverage starts. These rules went into effect for plan years beginning on or after January 1st, 2014. Although the rules went into effect in 2014, there were thousands of people that went without care due to this law prior to 2014. Working at hospitals, I encountered many that sought care in the emergency room for this reason. Individuals with kidney failure showed up at the ER just to be dialyzed because they could not get insurance because of this pre-existing illness. Hospitals saw an influx of admissions of uninsured patients for pre-existing conditions such as respiratory, kidney failure, hypertension, and heart issues. We all know that physicians are not interested in insurance companies that payment rates are low or fail to pay on time. However, there are some practices that will take all insurances. Most people seem to think that practices that take all insurance does not give good care, but that is not the case. Usually do practices take all insurance because they are trying to establish their practice. According to lowcosthealthinsurance.com, sometimes a provider may not feel that the offered amount is enough to cover their expenses. When this happens, they will ask for more. Health insurance company will try to reach an acceptable agreement for both parties. However, if this cannot be done, a provider will not accept the insurance. Physicians have large overheads they are responsible for. More so, they have to pay their staff, they have to pay for their malpractice insurance. When we think of all those expenses a practice has, this is why physicians want to contract with an insurance company that pays the most and pays on time. On the other hand, insurance companies are more inclined to contract with practices that are negotiable with their rates. Insurance companies like Blue Cross Blue Shield Federal, MetLife, Dental are companies doctors prefer. I changed my primary care provider, and when I called to make an appointment, with a new provider, I was asked what kind of insurance I had. I stated to the clerk that I had Blue Cross Blue Shield Federal, and she said great. At that point, I knew that that insurance was a good insurance, and that was more perfect. 5 years ago, I went to a dentist, but they didn't check my insurance until I was done with my visit. And at that time, the clerk discovered they don't take Humana Dental. I asked, well, what insurance do you take, and which is the best? And she handed me a list of insurances. This is an example of physician preference when it comes to insurance. I was told Humana doesn't pay much, but MetLife pays the best. There are so many insurances out there to determine which is better and which doctors take which insurance. This could be quite frustrating. Healthcare and dental insurance is a necessity for all. Some don't feel the importance of having insurance because they think they are healthy and it is not needed at this time. However, it is known that many think that the ER is a drop-in point for care and they don't want to be turned away. Sad enough that so many are uninsured, and not because they have the money and won't pay, but they can't afford to pay. On the other hand, so many can afford to, but rather not. I would like to leave a few words of hope with you all tonight. Just keep in mind the Affordable Health Care Act is being looked upon by our government to become more cost-effective for all Americans. Rising insurance premiums has dampened the lives of many Americans. It has caused many to suffer due to financial burdens. Not only did rising insurance premiums bring distress to many Americans, but finding physicians that would take their insurance was quite an ordeal as well. One good thing that happened that saved many American lives was the law that went into effect in 2014 and mandated that insurance companies can no longer deny any person with a pre-existing illness. Our American health care is headed in the right direction, with lawmakers working diligently to revise the existing affordable health care we currently have. If anyone would like for me to explain the details of my personal experience, I am open to questions at the end. Remember, there are insurances out there that are affordable, so don't be discouraged, but seek out and compare insurances, and you will be surprised at what insurance out there for you. Thank you all for coming, and if there's any questions, we have open forum. Thank you.
Thank you.